Welcome back to another episode of the Behind the Counter Show. Today we are here with Dr. Jag Desai at Core Medical and Wellness in Lyndhurst, New Jersey. Dr. Desai also has offices in Aberdeen and Clifton, New Jersey. And Dr. Desai specializes in regenerative, sports medicine, and of course also pain medicine, which is what we're here to talk about today.
Yes.
And John from HB Pharmacy, one of the pharmacists there as well. My name is Vince.
Good afternoon, everybody. Doctor, thank you so much for inviting us once again into your office. I have to compliment you on the facility. It's really amazing, and you really did a nice job putting it together. A lot of thought, and you feel better just coming in. I have to tell you,
Oh,
it's really
thank you.
very welcoming. So
Thank
well
you,
done
yeah.
with that part of it.
Yeah, we designed it specifically to give patients and their family, a personalized experience, especially now, in the post-2020, COVID era. We designed it in a way to provide for social distancing, privacy, and an overall better, safer experience.
Yeah, well,
Sure.
Thank you.
it's working. It looks great.
And speaking of the COVID era, we're talking about pain management. And honestly, going back to 2019, even early 2020, before the pandemic, this was probably the biggest hot button issue in the healthcare space that kind of was overshadowed by the pandemic last year. So being in the pain management space, obviously there's a little bit of a stigma, and we see the same thing at the pharmacy. There's
Right.
with all the regulation change and that kind of stuff. And we're here today to talk about responsible pain management and how, yes, there's some abuses and that kind of stuff, but there is a place for it when done responsibly in healthcare.
Yeah, no, absolutely. I mean, the opioid crisis was up front and center in healthcare, rightfully so. I mean, there was definitely a need to address it because it needs to be done safely, ethically, and there was a need for change and reform. So I'm glad it was being discussed, and I'm glad you're discussing it today because we don't want to forget about it.
Sure. So what are the types of patients and issues that you see in the pain space, and when do you recommend pain medication? How do you look at it? Let's, I guess, kind of start broadly there.
Yeah, so pain. There was a time when it was being promoted as a vital sign, and the fifth vital sign, and it was a way to gauge how a patient or individual is doing health-wise, because your body uses pain as a way to signal something is not working properly. And then from there, the specialty of pain medicine involves, treating multiple aspects of injury, whether it be pain related from orthopedic and sports injuries, whether it be pain related from cancer and tumor disease, whether it be from neurologic disease, muscle spasticity. All these different components, can cause pain, and they can all require some form of treatment, one versus the other. And it's our job to try and find a safe approach to treating it.
Sure. So how do you manage it at that sense? I guess, like, when do you decide, okay, this is, gone beyond physical therapy or some of those kinds of things and crossed into that, like in the sports realm specifically, for example? How do you kind of differentiate that? And, I'm assuming you look at each patient differently and that kind of stuff then?
Yeah, absolutely. You start with, each patient individually, you get a history, understand what the injury was, understand the time frame of it, determine whether it's an acute injury versus more of a chronic injury, because those are important to differentiate in terms of how you're going to treat an acute injury versus something that's becoming more chronic, and what the mechanisms are that are making it chronic. And once you understand those, then you'll be able to come up with a little bit more of a finer tuned treatment plan.
Sure. What about on the regulatory end now too? Like, there's this pain contract going around now, or pain contract thing, or whatever. And we see some of that at the pharmacy too. So what are those exactly, and how do they impact patients and the whole process of going about getting care?
Yeah, so the pain contract was instituted as a way to try and be more efficient in how a physician is prescribing a certain class of pain medications to a patient. In particular, we're talking about the opioid family of medications. And without going into detail of what's in the contract itself, because every medical office or institution will have a different language that they use in the contract, but the pain contract itself is an agreement between a patient and a provider or a facility, such as a pharmacy, in terms of how the medication is going to be prescribed, how it's going to be used, and how it's going to be dispensed. So it essentially is an agreement between two parties that say how the medicine will be prescribed, and usually it includes, the restriction of not being able to get the medication from other sources, so that way it's not being overprescribed or overconsumed or diverted in any way. So it's a good effort and a necessary component of pain management.
I've heard you even say times before too, John, about, in related to that, treating patients locally, and especially the prescriptions expire much sooner now than they used to as well, right? So having that local element can add, some element to the care, make sure it's monitored effectively and that kind of stuff too, but also make sure it's not abused in that sense as well.
Right. Well, I think that, just like with most things, with regardless of what the medical issue is, in this particular case, we're focusing on pain management, but if you're working closely with the doctor and the patient's coming in, the doctor going to one pharmacy, that's the best way to manage things. It's when people go to 2 or 3 doctors, or maybe go to 2 or 3 pharmacies, where people start getting into trouble. And unfortunately now too, with the way that they've developed this prescription monitoring program that we have now, we have access to be able to see things in pretty much real time. If somebody is going to 2 or 3 pharmacies or has gone to different doctors, and the doctors can use that program as well now. So, and we can check now every day or month that goes by, it's expanding, so we can even check more states. So we can really check around the whole surrounding area to make sure somebody's not doing something that, maybe hurting themselves. They, get to these points where they're desperate and make some bad decisions. And so there's all these programs like the contract and also the monitoring programs help us to make sure we're making sure to take care of the patient,
And what's that monitoring program called again?
It's the PMP.
You down with PMP? Yeah, Sorry, I had to.
When I first got access to it, I was humming that same song.
Were you actually?
The first time I logged in.
I never thought of that. I know the song.
It's a good way to remember to use it.
Yeah,
So,
sure. There you go. So, in addition to the traditional pain medication, what else do you do here at your office in that space?
So a lot of what I do is interventional pain medicine, which in addition to some of the medications that are available, whether it be anti-inflammatories, anti-neuropathic medications, or the opioid family medications when needed, I do a lot of the interventional stuff, which includes joint injections, whether it be with an anti-inflammatory steroid-based medication versus some of the regenerative medicines that are, or biologics that are now available, PRP and stem cells being one class of treatment modality.
Gotcha. Cool. What's the effectiveness of those things, or the difference in when you would prescribe one or the other? I didn't realize you did all that other stuff here too, in addition to that.
Yeah, no, so the effectiveness will obviously vary based upon what you're treating and the extent of disease that's present at that time. But it's a attempt to help your body's normal healing process be optimized, help maintain function. A lot of the athletes nowadays are getting it as a way to recover from soft tissue injury and slow down overall degeneration so that they can get back into practicing and performing at a high level. Gotcha.
Interesting. So beyond the traditional medication and like some of these other more modern, innovative approaches, there's compounding medication too in pain management. So what kind of compounded medication do you recommend when it's relevant, and how do those differ, I guess, from some of the traditional approaches?
Yeah, I'm a big fan of compounding medications. I use it myself for certain conditions and symptoms that I have periodically, and I try and recommend it for patients as well, because there are a lot of different things you can do with compounding that benefits an individual patient, because it's essentially a medication that's individualized for an individual patient versus something that comes from a big, large pharmaceutical company, which is one dose fits all type of approach. But the compounding in itself allows the flexibility of adding various classes of medications, whether it be anti-inflammatories such as diclofenac, anti-neuropathics like Lyrica or pregabalin, painkillers such as ketamine. All these different types of medications can be compounded and provide a right cocktail for the symptoms that you're trying to treat.
The thing too that I like about again, everybody is an individual, and we always look at things that way, whether you're coming to the pharmacy or to the doctor's office. And I always stress everybody needs to work together as that triad to make sure we're doing the right things for people. But when the compounding solution seems to be the right way to go, the reason why I think that it's great to be able to do that is because, again, also like Doctor said, you can tailor the dose exactly. So you can, alter it if they need 6 milligrams of 6% of lidocaine or 5%, or if they need ketoprofen or diclofenac, we can alter the percentages. If it's working, but we need to increase it a little bit, it's no problem. We're making it right for them, just for them, so it's not a problem. It's not an issue at all. It's what we do. But I feel like the big advantage is the side effect things, because a lot of these non-steroidal anti-inflammatories, for example, which are great medicines, but taken in high doses, you can end up with stomach issues, GI bleeds, and things. And sometimes when you're taking things topically, in addition to the fact that you're putting it right on the area where you have an injury, let's say, somebody has a knee problem, or sometimes or whatever particular part of the body that's hurting, you're also bypassing, taking it orally, which sometimes can cause some unwanted side effects. So
sure,
you have some really good perks with doing that. So that could be the right fit for some people.
Sure. Now, from your perspective, do you look at these sorts of things as a complementary treatment to the traditional modalities, or is this like a separate kind of category? Do you do these in cohesion with other things, or you mentioned NSAIDs too? Like, how do you?
Yeah, I think
that?
you tailor it to what you're trying to treat and to the individual patient. Sometimes compounding should be the primary modality because, like John alluded to, your body may not be able to tolerate a certain dose of an oral tablet of an anti-inflammatory, and it'll lead to gastritis or heartburn or reflux, and those are problems that you want to avoid, because if you let it play itself out, it can not be such a good thing.
Yeah.
So compounding may be a better approach to get the right dosage and apply it to where it needs to go.
Sure. So there's, we've talked about a few different innovative ways to approach this. We've heard, we know about it at the pharmacy, but more and more people are talking about this thing called Lowdose Naltrexone and how that can, help or be a part of the equation here in terms of pain management. Are you familiar with Lowdose Naltrexone, or can you explain a little bit how that works?
Yeah, so that's, glad you brought that up. That's, really some of the new exciting treatment modalities that are coming out as an alternative to opioid therapy. And, I myself am educating myself every day more and more on it because I think there's some promise there as to how it can be utilized to treat a lot of our patients who have chronic pain and degenerative diseases.
So
the interesting thing about naltrexone, or low-dose naltrexone, they call it LDN, but really it just means low-dose naltrexone. And if you hear naltrexone and you hear opioids, the first thing you say is, well, you never would take an opioid and naltrexone together because, it would counteract, the naltrexone would counteract possibly the effects of the opioid. But with pain management, which is pretty exciting, and we're exploring more all the time, and then like the doctor says, educating ourselves on this, instead of just using low-dose naltrexone, there are different things called like very low and ultra-low-dose naltrexone, and believe it or not, these might just very, very small amounts of naltrexone, again, added in with the opioids, like not at the same tablets, but we compound the capsule of that. It's we've seen some results, and we've worked together with some patients where we're able to decrease the amount of opioids that they need while still managing their pain, and it's kind of pretty exciting because at the end of the day, we want people to feel better. We want them to take as little medicine as possible, and I think it's something that I think that area is going to continue to grow, and we're going to continue to explore it because it's really been very promising thus far.
Interesting.
Yeah, as John had said, like some of my early impressions are that it can help reduce the dose of opioids that you're currently taking, or for that matter, help prevent an escalation of doses because it makes your current dosage, what you're taking, more effective, so that way you don't require a higher dose.
Sure. Speaking of reducing the escalation, have you tried anything? Are you familiar with CBD at all in that space as well? Yeah,
that's one of the other up and coming cutting edge treatment modalities that's you're hearing more and more about every day, and some of the data is starting to come back that shows that it can play a positive role in reducing pain, reducing inflammation, improving recovery from activities. A lot of athletic patients and those that are exercising, whether it be for Spartan events or endurance events, they're looking into that as a way to prevent injury and recover from exercise.
Sure. Yeah, I actually used it myself on my knees all the time for playing basketball
Yeah.
and that kind of stuff. Just
Absolutely.
to help some
The topicals. A lot
can't
of
jump
people
like
take,
I used to,
Yeah.
we see people use it orally for different things and sublingually, but it's the roll-ons and stuff like that are definitely another alternative to some of the other topical things, whether it be, and again, that's over the counter too. So sometimes when you're just trying to supplement medicines and trying to take as little as possible orally, getting something over the counter that's effective and can give you a little bit of relief is really worth exploring.
Sure. Do you have any thoughts going back to kind of what we were talking about at the beginning? And there's a little bit of a stigma with pain management sometimes, and like maybe more so from the patient's perspective and the provider's perspective. But there's people don't want to feel like they're doing something wrong, but there's obviously still a need for it. How do you feel about that, or how do you approach that with your patients?
Yeah, no, obviously, with the opioid crisis and the media's coverage of it, there was definitely a discussion as to what the role the pharmaceutical industry as a whole played, what role the medical industry, the physicians played in it. And I'm fine with that discussion because, the way I've always approached, my training and my, treatment of pain of medicine, I've always felt was in a qualified, safe manner. I think what's important for patients to understand is it's important to go to a board-certified
Sure.
physician who understands pain management from a comprehensive approach, because it's not just about prescribing opioids, or it's not just about doing steroid injections or just one modality. It's a combination of treatments that's going to give the best outcomes. And I think you need to, as a patient, feel comfortable that your physician or provider, understands all those different options and recommends, what they think is best for you.
Sure, that makes sense. Yeah, it's not necessarily just about here's the pills. It's like, okay, well, what are the right ones and the right amounts, that'll actually be helpful and not going to go over the top or cause some of these side effects or some of
right. And I think it's important, from the patient's side, to understand that opioids, there is a role for it. It's not that you should feel ashamed that you're on it, because there is a role for it, and there is a role that was recommended from a chronic pain perspective for it. And there are guidelines as to how you should take it and how you can prescribe it safely. So, one of the things that unfortunately happened during the whole media coverage of the opioid crisis was, a lot of people were lumped in together. And it's unfortunate because sometimes, patients that are taking it in a safe, right manner were being, lumped in and stereotyped with someone that was getting it from multiple pharmacies
Sure.
or multiple different locations, and not disclosing that and abusing it for one reason or the
Diverting
other.
it, all that.
Diverting, exactly. And it was unfortunate because the coverage of it, lumped everybody together. And we know, as a physician, I know that that's not everybody. And that there is a safe role for it, and if we can combine it with some of the adjunctive therapies, especially the cutting edge stuff, like the low-dose naltrexone that John mentioned, then, it can have a beneficial outcome for you.
It's a really good point you brought up. I mean, I can't tell you how many people that I knew that were just regular, legitimate people who, when everything was coming out, the opioid crisis actually created a different kind of crisis, and that's, and it was a difficult time for those people who had genuine pain and stuff like that. That they did get lumped in. That's an excellent point you bring up. And listen, hopefully we're moving past that. We're all trying to work responsibly to help people, and we try to encourage people to seek out professionals like yourself who are going to, approach it with a wide variety of modalities, whether it be the injections, making sure that they're doing their physical therapy and using the pain supplements, pain to supplement and as well. So it's just just being careful, being responsible, and we all have to be there in that together. Patient has to be on board with that. The pharmacy has to be on board with that. And we all have to work together to make sure that we're taking care of the person. And but I think that we're moving towards a better place now with that kind of thing.
Yeah. Do you have any other thoughts here, doctor, as we wrap up about pain management as a whole?
I think, look, pain is an important signal from your body that something might be going on, and I don't think it should be ignored, both from a patient's perspective and a provider's perspective, because it's telling you that something needs to be investigated, and once you understand that, and you find a reputable physician that can help you do that investigation, and come up with an adequate treatment plan once they understand what's going on, then I think it's important to look into that, because and also looking at the different treatment modalities, it's important to understand where you're getting your medicines from. If you're going to a compounding pharmacy, make sure it's a reputable one. Make sure they're using good quality products. And there's good resources out there, and John can tell you some great resources and websites that patients can go to find good compounding pharmacies and good providers.
Yeah, I think what he's speaking of, and specifically as far as compounders, it's important as a pharmacy, and as a pharmacist, I source my chemicals. We all see these different things that what happened with the COVID thing and how things were on back order and you couldn't get anything. A lot of it was because people were getting, even pharmaceutical manufacturers, a lot of this country's pharmaceutical raw chemicals come from China. And so one of the things we absolutely try to do our best is to completely avoid buying anything that has made its way from China to the United States. So, and the thing is that you have to go to a pharmacy that makes sure they buy their chemicals at reputable suppliers. So you can check. If you're looking for a good compounder, one way to check it is to go on the company called PCCA, which is Professional Compounding Centers of America, PCCARX.com, and you can look in there, put in your zip code. So wherever you're watching us and joining today, and we're happy to have you here, you could be out of state and stuff like that. You can put up your zip code, and you can find a list of people in your area that are part of that organization and are going to do a good job for you. So I do feel that that's very important to make sure you get the right person to help you make your compounds.
Cool. Yeah. Thank you so much, Dr. Desai, for having us today here in Lyndhurst.
Okay.
And thank you all for watching at home, and we'll see you on the next episode.